Good evening, everybody, and welcome back to school committee meeting number 328, tonight, Tuesday, November 17th, 2020. We have moved out of executive session and into public session. On our agenda tonight is a single motion. I'm passing over 3 and 4 that were on our agenda tonight. There is a motion under new business that states to recommend the delay of hybrid reopening for no sooner than January 19th, 2021. Is there a motion on the floor?
So moved.
Second. This motion has been moved and seconded. It was originally brought to the floor during facilities last night. Adam Young is chair of our facilities subcommittee, and we also have members of the administration as well as our district health departments here. I want to be especially respectful and appreciative for them for joining us this evening. So I want to start with Member Young speaking to what facilities spoke to last evening, and then I will pass it to Dr. McCall and our members from the health board so that they can speak first, and then allow members, of course, to ask their questions. As this meeting is being conducted via Google Meets, and I expect there are many members of the public that are watching us tonight, I would like us to have our cameras on out of respect for their time. Member Young, the floor is yours.
Thanks. Just so everybody knows, facilities and security met last night. What we're discussing, it wasn't a full committee, so I'll just make that. It was passed by Linda and I. We were in attendance. Matt didn't have the opportunity to attend. While this was unanimous, it was not. It was just of the members present. So discussed a whole lot of stuff. As it relates to reopening for hybrid, we discussed essentially 2 separate aspects of it. The physical readiness of buildings based on tours of, are you getting feedback? Okay, give me 1 second, I'll put the headphones back on.
And I think Member Brown, you're still unmuted if you can mute as well.
There we go. Okay, so let me catch up. So the rest of the buildings based on tours of Houghton, Choxic, the high school in Dawson, that Linda and I were able to do at the end of last week. Just as a sample of that are out there, as well as reviewing a third-party report on the HVAC systems. Then we discussed actual readiness, safety, and logistics of the district as a whole to be able to handle the level of cases that we've seen. On the facility side, we were on the whole impressed with all the work that had gone into it. Across the schools, we saw, and we believe that 90% of the way there, they were still doing work on it. Our largest concern was those classrooms that still didn't meet the CDC guidelines of 6-foot spaces. So after we discussed the facility side, we moved over to discussion of the COVID cases in all 5 towns, as well as a report from administration on a meeting with the local boards of health and some of the town managers yesterday afternoon. Just as some of the notes, with approximately 150 students and 300 staff that are currently in the buildings, the contact tracing capabilities within the district is already stretched thin. The boards of health also reported being near capacity on their ability to keep up with the contact tracing spike in the COVID cases. The current spike is larger than anticipated and concerning to boards of health. Again, this is our words, what we got from the report. I don't want to speak for the boards of health and those that are kind enough to join us this evening. From March to the present, Wachusett towns have had approximately 260 positive cases, and 60 of those were within the past 14 days. At the moment, Director Keenan is the one who's in charge of handling the district contact tracing, with the intent to shift some of that duty over to a resource nurse when we're able to hire them. So, and the way things are going, it wouldn't necessarily be Director Keenan able to get rid of that duty. It would just be adding one more person to be able to help them with that. So, inside the schools right now, which is that 150 students and about 300 staff, there's already been increases in the positive cases, and it's resulted in quarantines in some of these high-need classrooms, causing them all to go remote due to just staff and substitute shortages and staff needing to quarantine, things like that. And this is just in that small group that's in school right now. When I toured Dawson at 10 a.m. last Thursday, Principal Wallace had heard from 6 families that week within the school that, families that weren't even in school yet that had positive COVID cases. 2 of those cases were that morning, so from whenever she got in until 10 o'clock. By the time we met as a subcommittee last night, just within Dawson, that had increased to 14 families in the last week. And that's just one of our 8 elementary schools. If each of those families had only one child going to school, that contact tracing, just where, and we went into a lot of detail on the contact tracing and what's involved, and just tracking every single spot that person encountered throughout their school day, how close they were, for how long, and then contacting each of those people. It can just expand out quickly in a large number of people that need to quarantine. I did ask the direct question, do we have the resources to handle having 5, 4, triple, or even just only double the number of cases that we had to do contact tracing on? And the answer was no. We don't have, we're stretched thin as it is with the cases that we have. They were working over the weekend, this past weekend, doing this. So that's where we are. So based on all of this detail and a whole lot more that we discussed, a motion was made to recommend to the school committee to delay opening to no sooner than January 4th, 2021. This was amended to add the hybrid portion, and it was done to ensure that those students that are already in school, are high need students, that they remain there, and that program is able to continue on. Additionally, there was discussion on the date, and we had concerns expressed around having that decision point so close to the holidays, when the closest scheduled school committee meeting was a month before that. Even if we went as close as we could, the closest school committee meeting to that date is 2 weeks away. It would have been like around the 21st. So, here we are 2 days from, or 1 day from entering, and it's changed so much in the last week or two that we're now at this point in considering this motion. So to avoid this situation again, the motion was amended to push the day out 2 weeks to allow the district to, reconvene the school committee after the holidays, and also observe what was happening after the holidays with COVID cases. So the decision could be made before that move to hybrid. As it stands right now, as I understand it, and anybody correct me if I'm wrong, the plan that the committee has voted to approve, that we voted on back in August, had a reopening date of January 4th. We requested that they move that up, but as of right now, what we voted on was January 4th. So in effect, what this does is extend that 2 weeks. It does, so that's just on the protocol side. It does absolutely impact everything going on this week, and all that, but just from a procedure standpoint. I believe that's all I have. On a personal note, this is not from the committee. I'll take my 10 seconds. You know, 2 weeks ago, I would not support this. I would not even entertain it. But you know, this is not 2 weeks ago. You know, in the last weekly report from the state, just the town of Holden had 36 cases as a 14-day rolling average. As of today, we're at 71 in the last 14 days. So it's in the last week, the cases have doubled. So yeah, we're at a point where you're exponentially increasing. We're doubling in a week. You know, and each of our towns, according to the old metrics, when we agreed to our plan, you know, we'd all be in the colors, and a good portion of us would be in the red. Yeah, that's changed. We still have 2 towns in the yellow, and wouldn't be surprised if we're in the red at the end of this week. So that's where we are. So I'll open it up.
Thank you so much, Member Young. Dr. McCall, it behooves me to introduce you first, since I don't know our members of the health department. So I'd love for you to introduce them and to hear what they have to say. Oh, Dr. McCall, muted. You're usually so good about it.
Command D. So,
Command D.
yeah, thank you, and thank you, Member Young, for the synopsis of the conversation last night as well. You know, we do have a few members of boards of health here this evening, as well as the district doctor, Dr. Weiss. And, you know, what I'd like to do is maybe put it out to them, you know, first, talk a little bit about where they're coming from. And then I'll go through, I have a couple slides just to show the committee to give kind of a vantage point of where they're at. And Adam, I can tell you, Holden today had 12 positive cases just today. So that's why those numbers are just popping up. So Dr. Weiss, if you're on. Maybe Dr. Weiss isn't on.
No.
I think he was just on before, right, Brendan?
Brendan, do you mind reaching out and we can speak to our other members first?
Sure. Yeah, he's still on our list, but I'll reach out.
Okay, thank you. From Paxton, we have Julia Pingatori. Julia, if you want to talk a little bit.
Sure. So I have a lot to say, but I'll try not to take up too much of your time. I just want to start by saying that I really want my kids back in school. My 6-year-old struggles immensely on a daily basis trying to learn remotely. My 13-year-old, she's doing a fantastic job. I think she would prefer to stay remote if she had the opportunity to, but I want her to stay with her brother. And if you asked me a week ago how I felt about returning to a hybrid mode, I was still pretty gung-ho about it. I waited until the last minute to order the kids' supplies. Those have come in. The last of it came in today, and my kids are very excited to return. However, I can tell you that currently the data is definitely changing. Just to remind everybody that might not be super familiar with COVID from a public health perspective, the way that we are, the name of the game with COVID is to not overwhelm the healthcare system. So I know a lot of people make the argument that COVID doesn't have a high mortality rate, especially kids. They tend to process the virus very well. There are cases of, you know, this multi-system inflammatory disorder and things like that that come out of it, but they're fairly rare. However, the problem that we run into is that even a small percentage of the population getting sick and needing to be hospitalized can very easily overwhelm our hospital systems. And that's the problem that we run into. When our hospital systems get overwhelmed, people can't seek the routine care that they need and be able to handle the normal emergencies that come up, strokes, heart attacks, and things like that. They won't be able to get prompt care for those things because the system is already overwhelmed caring for COVID patients. And so I think that's an important point to make, because even when it's a very small percentage of the population that needs to be hospitalized as a result of COVID, when you're dealing with a small percentage of a large number, it's still a large number. And so that amount of people could easily overwhelm the healthcare system. What we saw in the spring is a different age range that was getting sick, right? So we had a lot of people in nursing homes, long-term care facilities with comorbidities and underlying conditions that got sick with COVID and required hospitalization. And we saw quite a large mortality rate, certainly alarming. And interestingly enough, we're not seeing that right now. What we are seeing is very large numbers of cases, but it's a younger age range that's getting sick. And when I say getting sick, that's a fairly relative term, right? Because many of them are asymptomatic, and some of them have very mild symptoms and wouldn't necessarily have known that they had COVID except for getting some kind of screening test. So when we're dealing with that situation, now we're not overwhelming the healthcare system as much, but the problem is that when we have this many people positive in the community and we have such asymptomatic spread of COVID, eventually it is going to affect enough of a number of our population to then get to that same level where we are now overwhelming our hospital system. If you look at the data, and I think some of that will be presented tonight, if you look at the data, we are already starting to see hospitalizations go up. And that's our big concerning number when we're thinking about how we're dealing with COVID, is those hospital resources. So speaking in terms of Paxton, we have about 5,000 people in Paxton. Many of you know that the criteria used for the heat map that had been generated by the state had recently changed. Prior to the recent change, we were being evaluated based on our number of cases over 14 days, per 100,000. That was sort of an unfair estimate from a data perspective, because it essentially asked us as a very small town to inflate our numbers to try to say what it would have been if we had 100,000 people, which isn't really great statistics. It's been changed. I still am not in love with the change, but it's been changed so that all towns with less than 10,000 people in them are graded the same. Now, Paxton, having only 5,000 people, is being compared to other towns that might have 10,000 people. And why this is important is because when I say that Paxton is yellow, or that we have currently 20 cases over the last 14 days during that most recent reporting period, enough to make us yellow. If we were a town of 10,000 people with that same concentration of cases, we would most definitely be red. That would have been 40 cases, and the cutoff is 25 to be red. So I just wanted to make that point. I can tell you that part of why I was really gung-ho about going back to hybrid up until now was because I have seen no evidence of in-classroom transmission. We do have one case, as was alluded to, where there was transmission. I think it's probably, not a normal situation, and it did result in transmission, unfortunately, within the classroom. Not to say that it can't happen elsewhere, but when we have 6 foot spacing in classrooms, it's not likely. And I can speak to this with some experience because I've been dealing with Anna Maria College since August. At Anna Maria College, we've had kids learning in person since August, and we have not seen a single case of in-classroom transmission. We've seen a lot of cases come onto campus, though, from commuters and from staff who are traveling back and forth between whatever they do off campus and then coming on campus. A lot of those people were tested and found to be positive without having any symptoms. Luckily, Anna Maria was doing twice weekly surveillance testing, so we were able to catch those early before it resulted in significant spread. I think the important note here is that we won't be doing that kind of surveillance testing in the elementary and secondary school levels. That was something that we can do in a private situation like a college, but not necessarily feasible here. That caught a lot of cases before there was spread. What we did end up seeing, though, was that when people were commuting back and forth and bringing COVID essentially onto campus, is that we would have these pockets of fairly large numbers of people that would need to be quarantined as a result. And what ended up pushing Anna Maria more recently, just last week, to have to pivot their learning model was because they were starting to run out of resources to be able to address all of the people that were quarantined. I'm afraid that that's more likely to be our limitation here. It's not so much that me personally, it's not so much that I'm concerned about in-classroom transmission or my kid's going to get COVID if I send them to school. I'm more concerned with the fact that once we start seeing this much COVID in the community, there's definitely going to be kids at school who turn out to be positive, and we're definitely, especially if not all classrooms are spaced at 6 feet, we're definitely going to have quarantine situations that need to take place. The other thing is the state recently adopted the CDC criteria for defining a close contact to include that 15-minute time frame within 6 feet, a 6-foot radius of a positive case, for that to be a cumulative 15 minutes over the course of a day. So it's not just a 15-minute block. And this really affects teachers in a learning situation, because a teacher might be walking around a classroom and spending time at different students' desks. If they spend 1 minute at a student's desk 15 times over the course of a day, that's 15 minutes, and that's sufficient to make them a close contact. And so what's going to happen is we're going to see these kids come in, they're gonna eventually, they test positive for whatever reason, they end up with symptoms, or they have a family member who has symptoms, they go get tested, they wind up positive. Now we have to trace those contacts back, and very likely these teachers are going to end up being close contacts, and now we don't have a teacher for that classroom. So now we have to backfill with a substitute, and how many substitutes are we going to have available to us for this? The other piece of it is contact tracing in and of itself is very time consuming, very laborious for the boards of health, the public health nurses, and certainly for those that are handling this, Brendan, in particular at the district level. I know I've gotten on some late night Google Meets in order to try to work out the contact tracing and provide the right information. I can tell you that I am the only person currently in Paxton who is doing contact tracing. I have a full-time job outside of this. And so trying to keep up with this is difficult. We do have the contact tracing collaborative at the state level, and that has been sort of the pop-off valve, so that, you know, when I get overwhelmed and I can't handle the cases all on my own, then I can send them off to the state, and the state can make sure that these people are contacted, that their contacts are traced, and they receive the appropriate isolation and quarantine information. However, on one of our more recent Department of Public Health calls, we were told that the contact tracing collaborative is currently also feeling pretty stretched because the numbers are so significant right now. So what we're dealing with is not only a bad situation in terms of the number of cases in the community and the likelihood that there will be positive cases in the school, but we're also looking at the possibility that contact tracing may not be able to keep up. And when that happens, we have a delay in notifying people that they need to quarantine, which can result in additional spread. So that is really the bulk of what I wanted to say. I think what the decision comes down to for me tonight is, does it make sense to start now? I want, just as much as anybody else does, I want my kids back in school. My 6-year-old needs to be back in school. It is really a struggle every day. And I'm home with him, and I feel it, let me tell you. But what it comes down to is, you know, we can get these kids back in school starting on Thursday. We can probably get through Thursday, Friday, maybe Monday, Tuesday with the resources that we have. And then people are going to go to Thanksgiving. And we all know that people are going to gather at Thanksgiving. And then we're probably going to see a spike, yet another spike in cases, you know, within the 2 weeks after Thanksgiving. We're not going to recover from that before Christmas. And so that puts us in a situation where looking at about 2 weeks after the holidays is in my opinion, a smart move just for consistency in learning. That way we're not pivoting back and forth between trying to get them in, get them back to remote, get them in, get them back to remote. I think the consistency is probably the better choice, in my opinion, as a parent. Even though it is very difficult for me to try to work full time at home and, handle my little guy and do the Board of Health stuff at the same time. So, it's not easy, but I hope you take that into consideration, that even somebody who's struggling with this feels that now is probably not the best time. That's all I've got. Thanks.
Thank you so much. That was really informative. I feel like I've learned a lot just in your short time tonight. Dr. McCall, would you like to introduce our next guest?
Sure. So I believe Dr. Weiss is on the line now. So Dr. Weiss, are you there?
Yeah. Yes, can you hear me now?
Yes, we can. How are you?
Thank you. Very good. I'm doing very well, thank you. Listen, my perspective is, I don't think it's a good idea to go back to, any in-school, learning at this time, even though there might be a lot of, good parts, to the in-school learning, socialization and everything else like that you hear, is beneficial to our children. But right this time, I think the cons, of COVID, right now do not allow us to go back to in-school learning. I'm in an urgent care situation, right now, that I'm seeing a huge, increase in the amount of COVID cases that are coming in. We're not talking about like hundreds, we're talking about doubling and tripling what I saw about a month ago, which was a relatively small percentage. As you can see from the states, it was somewhere around 1% or something like that. And then they got all excited when it went up to 1.03%. Well, now we're seeing, digits, whole numbers, 4 or 5%. And this is just me in one situation. I'm in one urgent care setting. I'm seeing, at least 3 or 4 cases per day, where I get maybe once in about a week or two, a positive case in my situation. I'm seeing, many family members coming in where they're in relatively small, school systems, and they're having to quarantine the whole classroom. One child, comes out positive, just as somebody alluded to before, is in a family situation. Maybe it will not be in a face-to-face learning situation, but a family member comes down, that child is in the school, and then all of a sudden, their 16 classmates, have to be, quarantined, teachers included, as somebody had just mentioned right before I came on the phone with you people. So I really think that it's not a good idea whatsoever at this time to increase our, COVID cases in the school district. The other statistics I was talking about is, you get one, little person, who is asymptomatic, and then I wrote a little letter to Brendan this afternoon. That person brings it home, and it's very often a grandparent who is the caregiver for the child before school, putting them on the bus or getting transportation, and then picking them up after school. They might be exposed to grandparent for maybe only an hour or two at a time, because the parents might have other duties. But that is, like I said, the geriatric population that gets hit very hard by this. Fortunately, the young children seem to be tolerating the COVID-19 relatively well. There's a case I was talking to Brandon early in the summertime where the immunological response to it, we're getting these super responders for little people, and it's affecting their immune system. And it's like having a nasty asthma or allergy attack on their immune system. Their immune systems are overreacting. It's not many cases, but that's what we have. And we don't know the long-term effects of having COVID. It's a brand new virus. It's less than a year old. We know a little bit of information about it, and we're getting more and more information at a time. So even though you might be exposed to it and say, okay, it's not any big deal, it can have ramifications, in the future that we just don't know about. I won't go on and on. I'll just close for now and say I'm very much against, starting even a hybrid model at this time.
Thank you, Doctor, and thank you for being with us this evening.
You're welcome.
Thank you, Dr. Weiss. And I think we have Richie Stevens from the Board of Health in Rutland. Richie, are you on?
Yep, good evening, Dr. McCall, members of the school committee. Richard Stevens, Rutland Board of Health. Julia did a great job capitalizing on where we stand in public health and all the concerns. So thank you, Julia, for taking the time to spell it out to everybody tonight. We've gone gray. We started at gray a week ago, and we're knocking on the door of red right now in the town of Rutland. We're seeing cases exceed daily count much more or above what we saw in March, April, and May. So we're in a little bit of a crisis. It's worse than the springtime, and I think it's going to continue for a little bit longer. I do agree with the doctor, and I agree with my counterpart, Julia. I think it's wise to wait till after we get by the Thanksgiving and Christmas breaks and see where we're at and what these holiday events do to our case count going forward.
Great, thank you.
Thank you. And Dr. McCall, you said you had a short presentation as well?
Yeah, I'll do a real kind of quick overview. Some of the members I think alluded to some of the information that we're going to talk about this evening. So if you don't mind, I'm just going to present my thing real quick. And can people see that?
I've got it.
Okay, great. So this is this slide just shows the Wachusett town's COVID case counts by week, and this goes back to July 22nd. So you can see down on the left-hand side, that's you have a couple towns, Holden and Sterling were both at about 125 at that time. The orange one is Rutland. They were probably like 51, 52. We have the blue one at Paxton. They were more like around 26. And Princeton, a really small amount, maybe 6 or 7 or 8. And fast forward to Veterans Day, and this is from Veterans Day, you can see that really steep climb that occurred. And, that's what I believe Dr. Weiss and Mr. Stevens and Ms. Pingatore were talking about in reference to this increase that has just really kind of kicked in, not just here, but across the state and, throughout the U.S. This is a 3-week average. So this is really, broken down. And again, this shows you what the 3-week average looks like in terms of those jumps. And it looks even greater. Again, these are the straight from the COVID counts across the United States. And you can see those increases in terms of the total amounts and where we are, where we just, I think today or yesterday, we were over 160,000 positive cases. In terms of Massachusetts, today, we were at, I believe, yesterday was 2164. Today, I believe we're up in the 2200 range. And again, this is that high mark that we hit November 14th, 3,000. This is the dashboard. And again, all this information is made available via the state, and they do a great job putting the information out there. But what's interesting about this slide is that it shows total cases by age group. And you can see that if you go back and you look at 0 to 19-year-olds and back in March, April, and May, that number is a much smaller amount versus where they're at now. And again, the largest amount here is 20 to 29-year-olds. And this is the slide as it's broken down, a little easier to see between October 25th and November 7th. Those are the total number of cases based upon age groups. Again, these are our daily confirmed cases since March. 184,511. You can see that we had a peak back in April, May, came back down. I think July and September, July, August, September, we saw some relaxation associated with some of the mitigation efforts to stop the spread of COVID. And that kind of then led to this uptick. We can tell you that there were Halloween parties, let's say, over that Halloween weekend that have led to these COVID cases that I think Member Young mentioned in his presentation, that happened right here in Holden. Again, this is the total number of hospitalizations, and Julia Pingatore was talking about this today, and just the concern around the number of patients who are being hospitalized now for COVID. And, again, these are non-ICU, and you can see, Central Mass, the percentage of beds and what's available and what's in use. And these are the ICU units. So there's been a pretty large uptick in that, and this is just from the 15th. And again, this slide shows the number of hospitalizations over from September 14th through the 15th, and it's a really steep increase. And again, the number of deaths. One thing that was, I've been paying attention to is just the information that's coming out from national experts on COVID, and typically the trend is it's 2 to 3 weeks after these cases kind of start to creep up, the deaths will also start to increase. So if you'll note there's a small increase here, but that will continue to rise. This is the dashboard that we've talked about. Brendan did a nice job pulling all this information together for everyone. In October, we had 4 positive cases. So far this month, we've had 4 positive cases, and we've had one, as was mentioned earlier, that was traced for the transmission within the school. And these are our positive cases by week and by location here in our buildings, and by month. And then again, this is the slide that we started with that just shows the drastic increase over the past several weeks. And again, one thing I did want to mention is that when we've talked about the situation associated with where we're at as a district, I think a couple people have said this 2 weeks ago, 3 weeks ago. This was a completely different story. We did not see these increases. We were not seeing the rate of hospitalizations, the rate of the positivity rates that have come in. And I think someone else said this, if they hadn't changed those metrics 2 weeks ago, every community pretty much east of the Quabbin Reservoir would probably be red. So those metrics changed. We're still in a situation where we're going to have some communities that are probably going to be right on the verge of red, if not red, this week. So again, those are the things that we've been looking at and we've been talking about with the boards of health. And I have to say thank you to Richie and Julia. They've been fantastic. We've been meeting with them now for months, and everyone is very candid and very open about the conversations that we've been having. And again, we also have members from Sterling, Princeton, and Holden who join us for those meetings as well. But that's really where we're at with it. I just wanted to give you the visual associated with this. And as we look at Thanksgiving break and as we look at December break, to me it doesn't make sense in terms of bringing students back for literally a couple of days, then having them go away. The strong possibility, and it's almost a guarantee, that you're going to have some another major uptick in cases soon after Thanksgiving. And then it's going to kick in again after the December break. And many communities are doing the same thing that we're doing right now, where they're making the decision to modify what they're doing. Some districts are in hybrid and they're saying, you know what, we're going to go to remote starting Thanksgiving, and we're going to pretty much go straight through the December break and then reassess where we're at. Other districts are taking it a little differently, where they're doing a couple of weeks on, a couple of weeks off, a couple of weeks on. When we're looking at this, because we haven't been in, we really want to ensure that we do this safely and carefully. And, as we've kind of talked through this, we met with our building principals today. Adam did a great job synopsizing the conversation that we had at Facilities and Security Subcommittee. So this is something that I strongly support as well. So thank you all for just taking time to listen to us tonight.
Thank you, Dr. McCall. And I want to give members a chance to either ask questions or have comments. Typically we go in the roundtable order, but I want to give people, we'll try to just raise a hand in the chat, and I'll call on you to have your say. Member Gustafson, you're first.
Well, I didn't have to be first, but
You're the fastest
I
at
got
the
a
draw.
text.
You would win on Jeopardy.
I got a text when we got out of our executive session that some others probably have gotten, with an update from the town of Holden an hour ago, just stating that as of the 17th today, Holden has 272 confirmed cases and 71 of them were in the past 2 weeks. So regardless of how that impacts our decision, I thought that was relevant data posted just in the past hour. I am interested to hear the discussion. It's no surprise I have been urging us to go back to school, and I think our students need to be in buildings. Not all students can access things remotely. However, I think this data is very concerning. And I will be curious to hear, I will certainly listen to the rest of the conversation that occurs. But I do have concerns about this data. Obviously, people did not heed the warnings to not gather at Halloween. Obviously, we've probably all seen the posts on Facebook about how do I get a test because I'm traveling to here and I don't have to get one when I get home because no one's going to check my paperwork and I'm going to have 20 people over no matter what. We've all seen pictures of teenagers unmasked all over town. I have concerns about the gatherings that people are going to have no matter what. I also have concerns about our kids in school. And not being in school, because I know a lot of kids aren't getting their education right now. So I think we have a duty to both educate and bring them to the building safely. And I think right now they're in conflict. I honestly, I will be curious to hear this discussion, but I'm leaning toward thinking that this makes sense to delay it, even though I really do want our students in school. One thing I wanted to clarify is that I think Adam said that there was a clarification that the students, highest need students would remain in school as they are now if we
Correct.
make this switch
Correct.
and delay. Okay. What I would like to hear is also perhaps some criteria or some discussion of how we would make this determination again come January.
Okay.
So we are not in this last minute situation, because I know that's also somewhat concerning to our residents.
Thank you, Member Gustafson. Member Young had a point he forgot to mention when he began.
Yeah, just quickly, I mean, this decision's an emotional decision. It has a lot of emotions involved. But what we really tried to do last night was to stay, strictly just for the facts that we had available to us, and we really limited it to those areas under the purview of our subcommittee. We were very focused on the impacts of personnel, resource limits to available teachers, subs, things like that. And except for the discussion on 6-foot spacing, we didn't really discuss even transmission within the school. Our large focus was that contact tracing and the quarantine impacts. So I just wanted to, there's a whole lot more to this, and I just want to encourage that discussion. Our committee viewed this aspect of it. Also, at the end, after we made the motion, we did stress to administration that we know there's students out there that are having trouble right now with this remote learning. And if this is what the committee decides to do, we implore the administration to enhance the outreach to those students that are having issues, and really try to bring that home. So that was it. I just wanted to make sure
Thank you. That you're coming at it from your committee's perspective.
Yes, and now it's to everybody. So
Now it's everyone's perspective. Thank you. Sherry, you're next, and then Linda, I'll check your comment in the chat. Hold on one second.
I wanted to thank the doctor and the members of the Board of Health who are with us, and I'm very glad they could be. Understand the ones that couldn't, but I'm wondering if Holden, Sterling, and Princeton Board of Health have similar or differing recommendations, or if we know.
Yeah, again, Julia and Rich, you were in on the conversation the other day. I really felt as though, when we kind of put it out there, we talked about what the various towns were going through. No one said, hey, don't close schools. What a bad idea. I think it was more, here's what we're dealing with in our, this is going to be really tough. Yep, this is really something that's going to be a challenge across the board if you guys do open up. Yes, there will be transmission spikes or spikes in the COVID case numbers going up after Thanksgiving and after the December break as well.
Thank you very much, Dr. McCall. Member Woodland, I'm going to have you go next since you were on the subcommittee last night. May have more to add.
I appreciate that, and I appreciate all of your patience for letting me jump in here. I just want to make sure that what's highlighted from last night is that we don't have 6 feet distancing across the board, and we have some inconsistent readiness between our buildings. So I had asked one of the principals that had done a site tour with me, and asked just candidly, how are you feeling about this? And he said quite bluntly that he wishes that they had until January. In our meeting last night, another principal joined us and similarly expressed a desire to have more time to finish out that last 10%, like we had discussed, of finishing all of those safe spaces, but then also looking around at the community around us. One of the things that we talked about extensively again was that contact tracing that's going on now, and how that's really stretching our capabilities at this moment, and that it's working for now, and especially when the resource nurse can be hired, that would be helpful. But to bring on, we have approximately 3% of our students in the buildings right now. To bring it up to I guess it's just under 50% that would then be in the buildings. That would be a pretty hard burden to carry through safely. And then the other thing too that I think that is interesting, in other studies that have been going on with other countries that have reopened their schools and have other things going on, there may not be school transmission, but when the schools are opened, it does lead to community transmission. And so that was just something that I think when we're already seeing the community spike, and I was part of that group where a couple weeks ago, I was pretty gung-ho about sending my 6-year-old in. Remote is a hard access for her. It's a hard access point for a lot of our students. But looking at the site visit, this information about our communities, I can't in good conscience send her back in to schools at this moment. However, I think that all of these pieces with time can be made to work. And so that's where my feeling came from out of our discussion, where we had hours of information that we were finding. And that's what I wanted to add. Hopefully it was constructive. Thank you.
Thank you. No, those are great points of clarification. Member Otmar is next on the list.
All right, thank you. I absolutely want to thank our representatives from the boards of health. I give an extra thanks to Julia as well, because as soon as I found out that this topic was added to the meeting today, I'd reached out to her just to be able to pick her brain on kind of what some of her thoughts were. And she's even able to carve out a little time so I could talk to her. Right after I got off the phone, I was like, oh, she's been invited. So she's carved out a lot of time, and so I certainly appreciate that. But absolutely appreciate being able to hear from these individuals on the boards of health, because certainly that's one thing that as a committee we have repeatedly stated, that we want to hear the insight, the opinions from these public health professionals, these experts on kind of to help inform our decisions for kind of how we go forward with things. And I'm thankful that they've been able to kind of share kind of their thoughts on things, and looking at how things are kind of not just moving in the wrong direction, but moving in the wrong direction faster than what we would have hoped for. And I think when we start to look at it, I think it does come down to, at best case scenario, kind of as was alluded to, maybe we can get kids in the buildings for 1 week. Cohort A gets a couple days, cohort B gets a couple days, and then after Thanksgiving, we're right back. And then to consider, is that the potential disruption from that, does the benefit of that offset kind of does the benefit of getting them in person for 2 days offset the disruptions caused by moving modes of learning back and forth? And so I think that's probably a part of kind of discussion that we would want to have as a committee, because thinking about the educational value of going to one model just to have to go back. Again, the experts have told us kind of their thoughts on it, and I'm inclined to agree with what they have told us so far. Thank you.
Thank you, Member Otmar. Next, I have Member Lavoy.
All right. Can you hear me okay?
Yeah, very well. Thank you.
So a couple of things that I just want to point out. One is communication. And I want to start with the communication of, one thing I've not heard anybody really speak to our public, our constituents, where 79% of our public is asked to go back to hybrid. The other piece that we haven't listened to our public on is our parents, our kids that desperately need in-person learning. The administration has failed to notify us as a school committee, the public, about key metrics that would drive back to school. I appreciate members of the Board of Health coming to tonight's meeting. It would have been great if you were here in August and September, when we as a committee failed to go back when we could have, when numbers were lower, when weather was good, when we took the easy approach rather than the difficult approach of figuring it out. We failed ourselves in communication as a school committee. I'm a member of the subcommittee that met last night. Not once on that agenda published for that meeting did it talk about this motion. Not once on that agenda, if a reasonable person read it, would you insinuate that we were going to even discuss a motion of delaying the start of school. I encourage everybody to look at that agenda. As a member of that subcommittee, I can assure you that that was never the reason for the meeting. The reason for the meeting was to discuss tours from the members of the subcommittee at schools. It wasn't to talk about public health records and numbers that would not really fall under the privy of that subcommittee. So I question today as to how an item this important made it to our agenda without us giving the opportunity to notify the public in advance and hear about that. Those are the people that elect us, and we're failing ourselves by listening to that community tonight. And that's all I have to say right now. I'm encouraged to listen to what everybody else wants to say.
Thank you, Member Lavoy. Next, we have Member Brown.
So we as a committee, we have to make choices all the time. And we make decisions based on what the facts are at that time. And back before September, we looked at those facts and we decided to go the path we did. And, for me, it's very difficult to look at this, and with all the hours that legal has spent with the MOA and getting ready for the hybrid, to look at it and go, okay, we should push that back till January. But, with the virus changing weekly, with the numbers going up, with other districts going the opposite way than what we're going, I find that it's challenging not to push this back. With what the Board of Health just told us, with the numbers going up, I just really do believe it's the wrong time for us to go into hybrid right before the holidays. We're a very complex district, and we're the largest regional, geographically, 5 towns. The busing issue was a concern back a few months ago, and that's why, with DESE's guidelines, with one student on a bench, that kind of, it tied our hands going back then. And again, We've spent a lot of time. We do have a, very detailed plan going in, but I do believe it's the wrong time right now.
Thank you, Member Brown. We have Member Ayala next.
Hi, thank you to the boards of health for coming on, and also the doctor. To hear their information was really valuable. I echo what Member Brown just said, and I understand what Member Lavoie is saying too, letting the community know ahead of time. I totally understand that. However, it is changing all the time, and this information is valid. We expect our teachers to walk in the building too, not just our kids. We got to look at that. If we get one sick teacher, two sick teachers, how many teachers are going to be out and not teaching our kids anyways? So there's that in play. Kids stay asymptomatic. The Board of Health pointed that out. Our kids can pass it to each other not knowing it, not even knowing they have it. To me, one kid, and I've told this to Dr. McCall, one kid is too many, one teacher is too many. They get sick, worse off, die. They're not going to learn. They're not going to teach anyways if they're not here. I've lived it, so this is why I can say it. So I'll point that out. So I do agree that we really need to look at all the metrics. We could have went in earlier. I know a lot of parents and a lot of stakeholders said we missed our mark, but we weren't ready to get in. We did, as Member Brown said, our buses were not ready. Our schools definitely were not ready. Our teachers were still scared at that time. Everything was so new. So I want the members, I want the community to really, really look at this in a whole, because I know there's going to be a lot of unhappy parents and caregivers out there, but they have to look at this as a whole. So that's really what I wanted to point out tonight. Thank you.
Thank you, Member Ayala. Member Kirschenbaum, please.
Thank you. It's clear to me that, well, first of all, I want to say thank you to the members of the Board of Health who have come here to give us basically the harsh realities of what we're facing. We've been, as Member Brown said, we've been facing difficult decisions since the very beginning of this whole crisis. There are people in our community, children, families that are hurting, and this is going to hurt a lot. Delaying the opening is going to hurt a lot. We were not ready, as Member Ayala said, we were not ready at the beginning. We have a complex district with lots of needs, lots of challenges, chronic underfunding, which depleted our resources. We don't have those resources back, which is one of the reasons why we are at best sort of ready and at worst not ready at all. So I guess, I know that this is going to hurt. The story, the argument, and the evidence is very compelling to me. My questions remain is, if we push this off until January, what resources do we need to have in place instructionally to help make this a go? What instructional technology integration specialists do we need? What technology resources do we need? What nurse staffing, guidance staffing do we need to get things going so that we are ready? Can we open up partially? Can we take our kids who are not just high needs, but who are most vulnerable, who are still trying to learn to read, those kids that are so young, that are just beginning their education? Is there a way to get them in incrementally between now and then? I implore the district to think about how we can help those students that are struggling, that we're not reaching in this model, because we're not reaching all the kids. My kids are successful, but I know that that's not the norm for everybody, and we need to help those kids that are underserved right now.
Thank you, Member Kirschenbaum. Member Shapiro, please.
Hi, yes, listening to everything everyone's saying tonight and emails that we've been getting for the past week from the community. Again, 2 weeks ago, gearing up for hybrid, getting all excited, get the kids back into school. But just for the past week, there's just been something that's been just been bothering me about seeing these numbers, and they really have. It's become a real concern. But one of the things that I just kind of want to remind the committee that when we started off and we voted for online, to start off at an online, the way that I remember it was that, back in September, before August, September, when we decided to start this way, was that we would try to get together and put together a really good online program and focus on that. And we picked the date of the 18th, the understanding that we were going to look to our experts as to where we were with this virus at that time. And the experts have spoken, and I think we need to be listening to that and listening to them and adjust the plan accordingly. And as Member Kirschenbaum was just saying, is that let's take this time now that we have, if we decide to extend till January, to get it really down, so we are really ready in January to hit the ground running. Look at the numbers then, and be ready then if the numbers are better, and I really pray they are. So that's just what I wanted to point out, is that this date of the 18th was meant to be a date, but we have to listen to the experts, and that's what we need to think about. Okay, thank you.
Thank you very much, Member Shapiro. I have Member Dennis, Member Smith, and then Member Mills.
Thank you. So, and thank you to those our guests who attended tonight on I'm sure it's very, very short notice. We appreciate you being here. I appreciate you being here. It's very frustrating to me, and I think that it's very frustrating to many in our community, although we have not had the benefit of a public hearing tonight to hear from them, that we're having this conversation on the eve of our plan to reopen for hybrid. Since July, I and several of the members in this committee have asked, what are the entry criteria and entry metrics that need to be satisfied in order for us to move in to hybrid learning? We never have received this information. The school committee has passed a motion in September expressing concern over the status of the plan and asking for, again, the entry criteria for a successful return to school, and including the metrics, amongst other things. We have still not received that information. We met last week as a committee. I reframed the question. What are the criteria that hasn't been met, or what is it that needs to happen for us to continue with the plan to open on November 18th? And the response was, we're in a good place. We're in really good shape. So what do we know? We know that there has been tremendous effort into the school and our district following the DESE guidance that have been given to us with regard to safety protocols, not just DESE, but DESE based on information from the departments of public health that we followed. We know that it is not clear to anyone how students are going to be taught when they're not in the building. And we also know that despite that, over 80% or approximately 80% of the families in this district would still prefer going to hybrid. Now, to be certain, this is not the best time to start. And we could have anticipated that 3 months ago. We could have anticipated that a week ago. But when is it going to be the best time? So here's my concern. If we delay to January, chances are we're going to delay to April. Once we get to April, we're going to be basically towards the end of the year, and I don't think there's going to be a will to go back. So if this motion is supported tonight in its existing form, I think it is more likely than not that students will not return to buildings in this school year. What I'd like to do is offer an amendment
Um,
to the motion that's on the table.
would you mind if people do you want to amend now? I really would love to have everybody have their say.
Sure, but I would like to have the opportunity to make a motion to amend the existing motion.
You would, all right, then what is your amendment?
So I'm not opposed to having other people speak on the motion that's on the floor, but I would like to be able to circle back to make an emotion, to make an amendment.
Yeah, you'd be first. I just have 2 members left and then it would go back to you, sir. Member Smith and Member Mills.
Thank you. So a huge thank you to Julia, Rich, and Dr. Weiss. I really appreciate the information that they provided tonight. As I've noted at many meetings, I'm very concerned that in the high school, we have over 15% of our classrooms that won't have the 6 feet of spacing. And we've just heard how important that really is. So that's something we need to work on. And it's really unacceptable to not have that based on our guidelines. To hear concerns about the ability to contact trace and that the system is becoming overwhelmed, and that this is not only at the school level, but at the district level and at the state level, I'm concerned just as a citizen of the state of what that means for all of us and for public health. When we think about the transmission that's happening in our 5-town communities right now, some of this may be due to choices that families are making or individuals are making. And unfortunately, we are not doing enough as a state to stop the spread. The numbers are alarming with our current timing, and having in-person learning for all of our students, it just doesn't seem like the right time at this moment. It's not probably the right choice right now. And while this may be upsetting to many in the community, what is more upsetting is that we're not heeding the advice of our medical professionals and our numbers are rising. The virus is tricky. We need to do something. Even institutions with surveillance testing are going to remote situations at this time. To get our kids back in school, in-person learning, we need all of us to commit to stopping the spread. And I won't be able to support going back to in-person at this moment. Thank you.
Thank you, Member Smith and Member Mills and Member Longbaliel, and then I'm going to move to Member Dennis's motion of amendment. So Member Mills, please.
I won't spend too much time just repeating what Mike said, but it's frustrating that I've never heard what the metric is, right, of what makes this decision. I've heard that there's one in school transmission, and we can make the argument one's too many, but I don't know what the metrics are. We've never been told. I feel as though our communication here has been awful. You know, every time I've asked for what the remote plan is, I get that it's under negotiation. This isn't state secrets. Wachusett isn't special. With surrounding districts have managed to make this hybrid work, and I just want us to break the narrative that somehow we're so big and complicated that we can't do what other schools have managed to do. I agree that it's probably not the best time, but again, 80% of the parents want their kids back. I do think we need to be doing some listening, and we need to hear what is the metric, what is the data-driven reasons that we would open or not open. Because I echo Member Dennis's observation. I think if we don't go back now, I don't see why we go back. I don't see us going back until April, and I don't see us getting information in a timely fashion. If there's no deadline that's forcing people's hands, we don't ever get answers. So.
Thank you, Member Mills. Member Longbaliel, and then I'd like to go to Member Dennis's amendment, please.
I agree with Member Mills and Member Dennis. I have been, as I'm sure many have been, turning this over and over in my mind, reading and rereading all of the emails from parents, including those who want to stay remote and those who want to transition to hybrid. And they all make very compelling arguments. I heard stories of kids who are thriving on remote, and I've heard stories of kids who are really suffering, developing disabling anxiety that they didn't have before, and in at least one case, even more serious mental health consequences. I heard the representative from Paxton say that she's not concerned about spread in schools. That's really important to me, and that plays a major role in my thinking. I understand that there are logistical challenges to doing contact tracing, but that strikes me as something that we can address if we have the will to do so. I would like to know from the other school committee members who work in other districts if they are planning to transition from hybrid that they're in now to remote. at this point in time. I asked my kid, who actually is doing fine on remote, if he thought it would be worthwhile to go into school, even for 2 weeks or some short period of time. He said yes. I feel like by making this decision tonight, one day before we were supposed to start the transition to hybrid, that we're blindsiding parents and blindsiding the kids. We're pulling the rug out from under them. The parents on both sides of this issue have all written very compelling reasons for either staying remote or going hybrid. The plan that we created gives the parents that option, the option of keeping their kids remote or having them go to school. The plan isn't perfect, but it does give parents choices, and I think that that's essential to do. I will keep an open mind for the rest of this discussion, but at this point, I'm leaning toward toward transitioning to hybrid as planned. Thank you.
Thank you, Member Longbillio. With nobody else that needs to speak, we will transition to Member Dennis's amendment. Can you read slowly so I can write it down? Mike, are you still with us?
I'm sorry, I thought you had somebody else in the queue. Sure. So, building upon the discussions that we've heard today, I've heard there being some concern about going from 3% to 50%. We've had discussions all along about trying to have a phased-in process, and maybe there is some middle ground to do so. So the emotion, and I do think that unless we are able to establish clear metrics that we can follow and the community can follow, we're going to be in a very recursive situation. We do need to figure that out. And we've
amendment. Happy to let you to speak on the amendment, but I need to know what the amendment is.
Sure. So the motion to amend would be to recommend the delay of hybrid reopening for no sooner than January 19th for students in grades 3 through 12.
Okay. There's an amendment on the floor. Is there a second?
I'll second it so we can discuss it.
It's been moved and seconded. Do you have anything else to add to your amendment, Member Dennis? It's your.
Yeah, I would like to finish explaining it. So, again, trying to find a middle ground here so that we're not moving fully, if that is the concern that we're moving, going from 3% to 50% is too great a jump. I'm also sensitive to the notion that treating a 6 or 7 or 8-year-old is not the same as the needs and how we might treat a 16 or 17-year-old, for example. And so, if another way to approach this might be to take a phased-in approach, then let's start with the next group of those children for whom a return to school would serve the greatest benefit, or would be benefited most, while we continue to reassess and try to broaden that over time.
Thank you, Member Dennis. Would I have Member Silva's hand to speak? Remember, now we're speaking to the amendment on the floor, not the original motion. So you're to speak to Member Dennis's amendment. Member Silva?
So I want to thank our medical experts who spoke today. Honestly, the data is extremely concerning. And I do support what Member Dennis is saying, even though I was on board with the hybrid. But at the same time, I just wanted to gear everyone towards the positive side of things. We as a committee chose to start off remote, and part of it was so that we would be prepared in case if something like this does occur, that we are prepared to go remote and keep remote and still maintain as much of an educational consistency as possible for our kids. And I agree with Member Longbillio, who said, not having some of our kids in school is really hurting them in those fashions. And I feel for those families. I really am very worried about, pulling the rug underneath the parents who are really relying on school opening this week. But unfortunately, with the data that was just presented from medical experts, from people that we have been taking advice from the beginning to actually get to the hybrid approach, are now saying to us they don't believe in the hybrid approach as the best possible solution. I think we need to take that seriously, but also look into the positive side of things. We are already prepared to be remote. Our teachers are prepared to be remote. Our kids have the Chromebooks in their hands. And yes, there's glitches, but we're only going to get better. So as much as this hurts, I just don't want us to forget the positive side that we as a committee did decide to start remote just in case something like this does happen.
Thank you, Member Silva. Let me go to the list. I have Member Woodland to speak on this amendment.
So I just wanted to bring up the timeline of our plans. When Dr. McCall first brought the plans to us in August to vote on, the original plan for tomorrow's date was to have K and 1, and I don't believe 2, and then the youngest grade of each school going in on this date. Without a motion from the school committee and without a vote, some committee members asked to move all of the grades up to the November 17th date. And Dr. McCall came back and changed that. What I would like to know at this point, and that's just kind of a history lesson because I like history, but the question that I would like to know is what the Board of Health representatives, if they're still on, and I appreciate their time if they are, and what Dr. McCall have to think of on the one side, the health metrics of that, and on the other side, if we would be prepared to implement that changing the night before, because we do have, I've heard a couple of fallacies being talked about here with sunk cost and the slippery slope, but those are my 2 minutes, so I'm good.
Sorry, I've been trying to pause before the 2-minute warning and just chat got away from me. Actually, the next member had the same question for Dr. McCall. So your thoughts on the amendment, Dr. McCall, perhaps?
Well, I think when I'm, looking at this, and that was the original concept when we had first talked about this. But the original concept was talked about, again, in reference to, cases maybe not going up, and we were kind of in a process where we were, maybe leveling off, and we're getting kids into school slowly, and then it just and it would build up. That was kind of the thought process. The difference with where we're at now, and this is, I think, what people have been talking about, is just the spike over the past 3 weeks that is just so dramatic. One of the issues that we're going to face just moving forward is it's going to be staffing. It's going to be our ability to support kids. So I other districts have had to close schools, for days at a time because they do not have enough staff. We've already been, we've had 2 cases where, just at our early childhood center, we haven't had enough staff to support the kids because of illnesses. That's a concern ultimately, for us as well as we go into it. Do I think that trying to get the youngest kids in here would be, an amazing thing to do? Yes, it would, but I also know that it's going to be, we're still putting, the community at risk as we kind of go through this. And, when I look at this, I look at the number of employees we have coming into the district, the number of people who live in our 5 towns, and kind of how that's kind of playing out. We have very few people in school right now, and we're just seeing numbers go up, left and right. So that's kind of where I'm at with this. Is it something that we could do? Yeah, we just have to play around with bus routes again and change, many of those types of things. But again, it's not, we were planning on going full hybrid.
All right. So thank you, Dr. McCall. Let's go to Member Gustafson, and then I have Member Bennett. But I want to keep our conversation very focused on this amendment. I think the public deserves to hear whatever our answer is on this matter before midnight. Probably.
Yeah, part of mine speaks to the broader one, but the part that applies to this is that if I understand the amendment correctly, it is it would be bringing back the younger grades starting now, and then bringing back grades
Yeah,
3
I
through
wrote it in the chat.
grades
So-
3 through 12 starting in January. I would suggest that my concern with that is that the public health concerns that we have heard and the way that our data is going, I don't think that changes whether we bring back half of our students or a quarter of our students or all of our students. I definitely think a phased plan is a different discussion. And as I said earlier, when this amendment's done, we can hopefully come back to that discussion about how we bring students back whenever that is, whether it's coming soon and revising that or if it's later. But my concern is that whether we bring back pre-K through 2 is still a large number of students. I also think it would be very disruptive to our families to suddenly make this change. So I have concerns about that, and I don't think it alleviates the issues that brought this motion to the table in the first place, although I am very sympathetic to the sudden change we're discussing.
Thank you, Member Gustafson. I believe after you was Member Bennett and then Member Shapiro.
So I just have a quick question because I too have been reading all of the emails that have been coming in. And the concern that I'm reading most is the mental health of our kids, and that is a huge concern, and also at the same time there's a humongous equally humongous concern that this will spread the COVID virus amongst our community, our entire district, everyone. We've got elderly, we've got parents with conditions that can't handle this, teachers, lots and lots of people. So I would like to more focus on, and maybe this is out of line, but maybe there's something we can do to support the members that the students that we have that are having mental health dilemmas during this process, and maybe going remote right now, which I do believe is the best decision. We can focus on a really robust mental health situation for them.
Thank you so much, Member Bennett and Member Shapiro. And then if anyone else has anything to add on this particular amendment, then we can go take a roll call vote.
Yeah, so I don't know, Chair Weeks, if Member Woodland's question was really answered when she asked if the Board of Health folks could talk on the proposal of the younger kids going back, or is that not?
Let me see, is anyone still there from the Board of Health?
This is Dr. Weiss. I'm still here. I was waiting for your members to finish speaking.
Yes. That's what I wanted to hear. I wanted to hear from them as requested.
Would you guys mind speaking to the amendment?
This is Dr. Weiss. Like I said, I was waiting for the members to finish talking about the amendment. If you want me to comment now, I will.
Yeah, if you don't mind, that'd be wonderful.
Yes. So this brings up the same issue. I heard the amendment that was proposed that said it still brings the concern, bringing the younger children back. It's still a health concern that I have in my mind. One of the members that brought up a little bit while before is that, do we do this in January? Do we do this in April? Do we call it quits for the year? And just as one of the members had said, we're pulling the rug out from underneath the families that this is going through. But unfortunately, if you're watching the news, you're pulling the rug out from the general public. People are going in ICUs. People are dying. Listen, think of that as you make your decision. Listen, yes, the poor children, their mental health and things like that, you're pulling the rug out from those kids and their education. But also, you're pulling the rug out at this time. This is, a worldwide pandemic that's going on. Listen, the numbers right now are, climbing, more than we had back in March. Listen, the problem, that you don't know is how is this going to pan out? as I talked to Brendan earlier, this year, back in August or so, okay, the numbers were as such, they're relatively low. Then all of a sudden, they were only for the nation, they're only in the teens that we were getting per day, 13, 14,000, so new cases per day. We have doubled, tripled, and even 10 times that now. We're 160,000 in the nation per day that we're coming down with. You know how many people are getting the rug pulled out from and ending up in the hospital and on ventilators? Listen, look at poor Montana, look at poor South Dakota. Listen, yes, this might be it for the school year. You don't know how this thing is going. If you send these little children back, early, listen, they bring it home to their family members, and it perpetuates this and keeps the numbers going to 200,000, 300,000 a day that people are testing positive. Listen, this COVID thing is not going to end. And it's going to end just, in a year or two from now, maybe when we get the vaccine going and not too many people will die, just, in the long run. Listen, well, then, yes, it will calm down. But I think you people just set the precedent earlier this year by going to the online learning, which I don't think was a great idea, but I think from a public health perspective, it was fantastic. Listen, so please with this amendment, don't send the children back early. Don't perpetuate this COVID at this time, and think of the community as a whole. Thank you.
Thank you, Dr. Weiss. Julia, I see you're still on as well. Would you like to weigh in?
Yeah, I don't have a lot to add, but I think what I can say is that our reserves are tapped right now. Adding anything to it is going to put us over the edge. So I'm not sure I can get on board with bringing back even a small portion of the population right now. Thanks.
Thank you so much. Are there, Member Kirschenbaum, please.
Thank you. I would like to question the assumption that 80% or 75% of our community is choosing hybrid, honestly. I believe that the remote plan that we are offering right now is quite robust. It's something that I think that we can be proud of. But I think that going hybrid, there's too many question marks on how the remote will work when we go hybrid. And as a result, I think people chose the hybrid model under duress. I'm not saying it's a majority, but I believe that there are some people who chose hybrid because they did not see a viable remote plan moving forward. And so I would just caution our members to think about that when they assume that 75% or 80% of our community chose hybrid because they truly believe that that was the best option. I'll speak about my family specifically. We were planning on maintaining remote, but based on the information that I saw in our remote plan, once hybrid started, it did not seem like a good option. And so we had to, under duress, choose hybrid.
Thank you, Member Kirschenbaum. Before I get to my next member, is there a point of order?
Make a motion to extend meeting till 10:30.
Second.
Motion has been made and seconded to extend the meeting until 10:30. Is there any discussion on the matter? Okay, seeing none, Member Ayala.
Ayala, yes.
Member Bennett.
Bennett, yes.
Member Brown.
Brown, yes.
Member Dennis.
Dennis, yes.
Member Gustafson.
Gustafson, yes.
Member Haber.
Haber, yes.
Member Kirschenbaum.
Kirschenbaum, yes.
Member Lavoy.
Lavoy, yes.
Member Longalil. Linda. She might have stepped away. Member Mills?
Yes.
Oh, thank you. Member Mills?
Mills, yes.
Member Mitchell?
Mitchell, yes.
Member Otmar?
Otmar, yes.
Member Shapiro?
Shapiro, yes.
Member Silva?
Silva, yes.
Member Smith?
Smith, yes.
Member Williamson?
Williamson, yes.
Member Woodland?
Woodland, yes.
Member Young?
Yes.
Chair votes yes, the meeting is extended to 10:30. Next, we have Member LaVoy, Member Dennis.
I just have a couple quick follow-ups after concern. I think it would be prudent for the members of this school committee to perhaps consider reconvening or delaying this motion to tomorrow night for a couple of reasons. One, I don't think any of us have a quantifiable number of students that this impacts on K through 2. I think, second of all, having the opportunity to hear from the public, our constituents, the people that vote for us to represent them, is pertinent. One thing this meeting did not have was that opportunity. And I am going to make a blanket statement of advocating for everybody who is impacted by this, that we need to listen. Communication is a two-way street. We're giving a lot of information, but we're not listening to our public. And I think we're doing a disservice. And I think that what we've heard, we can have a clearer picture to make a reasonable vote tomorrow night if we have those things.
Thank you, Member LaVoy. Member Dennis? Mike, are you with us?
I am. I'm fiddling with my camera and my microphone. So sorry for the brief delay. So I agree 100% with Matt. You know, and I mentioned it at the onset, and you know, frankly, I mentioned it prior to this meeting. The decision of this magnitude without having a public hearing, I think, is a bit of a disservice. I think that we've had some good dialogue tonight. I think that the intention of having this dialogue was right for us to do. But I would encourage us, and before I make a motion, or if anyone else does, that we should have an opportunity for the public to weigh in through public hearing on this matter before we make any final decisions tonight.
Okay, again, there's an amendment on the floor, so what we really need to do is vote on that amendment. Member Gustafson, do you have a specific comment to the amendment? I think we're starting to sway away from that a little bit.
I'm trying to think if it...
Something to do with having...
Yes, with the 3 through 12. Yeah. Not specifically. It can go back to the main discussion. It's related to things that have been brought up, but I don't know if they're directly related to the amendment. It's about the percentages and the part that was brought up about public input, but I think that's beyond the amendment. So I will, if you come back to me, I will repeat them when the amendment's done.
All right, let's do that. And let's really stay focused, guys. We can do this. I know it's getting late and we're tired, but we can do this. I think I have someone else in the queue. Member Young and Member Longbelial on the amendment, please.
Thanks. So, I mean, I've got to say, I mean, I'm tempted by the amendment, but the issue it addresses is larger than just that K-2 group. You know, it's the issue of students that, you know, are struggling right now in remote. And I think there's alternative solutions, you know, and I implore district and building administration to come up with those solutions. You know, whether it's smaller groups of a single class, being able to, you know, once a month, a class of 16, 18 kids comes in and they're meeting in an entire gym and they actually get a little FaceTime. There's a camera for anybody remote. You know, there's safe ways to do that where there's, you know, 10, 15 foot separation. And that's absolutely doable. And it, you know, that could make an impact. But I don't think just opening it up to K-2, you know, one, it is, you know, a member from the Board of Health and Paxton mentioned that we're already stretched thin. And, you know, this will make that worse. And I just don't think that this will help the situation.
Thank you, Member Young. And again, let's stay focused on the amendment. Member Longbaliel, please. And then I have, our discussions usually go about 20 minutes for a discussion on amendment. We're about 45 into this discussion. So let's keep ourselves focused, please. Member Longbaliel and then Member Mills, please. Linda, you're muted. Linda.
I'm so sorry. Why don't you come back to me?
Okay, I will. Member Mills, please.
I'm not sure if the chair will find this in order, but I'd like to make a motion to lay the motion on the table to a time forward till tomorrow's meeting.
Second.
Is that the original motion on the floor? Or is that the amendment? So we really need to deal with the amendment first.
Do we?
Yes. That's the way I got the Robert's rules. We have to do the
Okay.
amendment.
I don't know how to go about that because I guess I'll let you rule on how that should
I mean, I suppose if you do it that way, then you need to do it twice.
Yes, you would have to delay the amendment and then delay the motion. So it's up to you if we want to do this twice.
I seconded the motion.
I'm making a ruling on the motion, so. Member Mills?
I mean, I made the motion. It's been seconded, so I'll let you rule on what you think.
We can do it twice. So we are now delaying this amendment. So to tomorrow. Is there discussion on this?
So if I can speak to the motion, I mean, my concern is just that we have a motion on the floor where I don't know that the superintendent has had time to process. You know, there's been concerns about there not being a public hearing, so it seems we're coming to the point where, you know, a fresh mind might be appropriate. So,
Thank you. Anyone want to speak to the new motion on the floor? All right, here we go, guys. Member Dennis.
Yeah, thank you. So, you know, again, as I mentioned before, I think it's appropriate for us to have this in a forum where we have the opportunity for a public hearing. You know, the attempt of an amendment was to try to find middle ground. I don't claim for it to be the best middle ground, but I think that we, for a decision that is as impactful as this one, we deserve to hear from the public, and we deserve to give ourselves some clear headspace. The superintendent has already directed families to follow the existing remote schedule for tomorrow. We're not trying to kick this down the road. We're coming right back tomorrow, but I do think that having the opportunity for public comment is very important to this process.
Thank you, Member Dennis. Member Woodland.
So I guess I am going to take the unpopular opinion that we actually have heard quite a lot from the public. I don't know about you guys, but I've had an inundated inbox since March. And with every step that we've taken, I've heard a lot. And it really, the problem is that this is a safety and a health metric. And that's not really about public opinion. That's about facts. And this virus does not care about what our opinions are. So I understand the idea of having a clear head, but I don't see where that would actually get us. I don't think it would bring us any closer to transparency. I think it would make it more opaque to the public because they just want an answer. I completely sympathize with this idea of pulling the rug out from under our families with this week. I wish that we were talking about this long ago, but we're not. These are the facts on the ground right here for us, for our responsibility to our people. And I think it behooves us to make this call tonight so that at least there's a day, at least there's time. If we delay it, then we're just doing a huge disservice to our community. Thank you.
Thank you, Member Woodland. Member Ayala?
So we're asking to delay again if we wait to make a decision tomorrow. So what would we do? Send an email out Wednesday night saying, don't come to school on Thursday. What do we do with that? That's even more last minute than we are right now. And what are we going to do? Send an email out to parents tonight and say, we need your input by tomorrow night. And then we'll let you know by, 10, 11 at night on Wednesday if your kid will show up on Thursday. What are we going to do with that? I need an answer.
Thank you, Member Ayala. Member Long-Balil?
I support Member Mills' amendment.
Thank you. Member Gustafson?
Yep. So okay. I've advocated for going back to school since the beginning when we talked about this. I was actually one of 4 people who voted against this plan originally because it was not aggressive enough in that and didn't have enough detail about any of it. I point that out because I think it's relevant. I think delaying this decision does our constituents a disservice. I am looking at meeting notes from July 13th, and I know we talked about it earlier, where I quote, "Any plan we can make on day 1 will change on day 2. Every family needs to develop plans for all 3 situations and the ability to change quickly between them." I take verbatim notes at our meetings, and I posted these in July when we first discussed this plan. Every meeting, even though we have not had enough information or communication, in every meeting, the one consistency we have had all summer, all fall, in every presentation that the superintendent has made, even though I have disagreed with a lot of things in them, is that the ability to be flexible has been stressed because we are dealing with the virus, we are dealing with public health information, and I believe our public has had a chance to communicate on this anytime they want. They can email us, but I think it is a last minute decision, but they trust us to make decisions based on the health and safety of educating our students. And this is July 13th that this was in a public meeting, and I know it came up before that. So I feel from my perspective, like, yes, they want to comment, and I think they have means to comment, and we've heard from them, and I don't think that their opinions on this in 24 hours are going to help us make a better decision. We need to deal with facts. So that is where I stand, even though I know it's difficult, unfortunately.
Thank you. Member Otmar, Member Kirschenbaum, Member Brown, and then hopefully we have enough voices to vote on this amendment.
Thank you. Certainly one thing that has been stated kind of over again throughout this meeting has been how we're pulling out the rug from the families by telling them 30 hours before starting hybrid, things might be changing. What's worse than that would be telling them that 8 hours before their kids are getting ready to get on the bus. And so, as has been said, we're elected officials. Our townspeople elected us to do this job. They elected us to make this decision. If this is a grievous line that they can't abide by, they can talk to their clerks about recalling us or vote us out in the next election. But they voted us here to make these decisions. So I think we should make this decision.
Thank you, Member Otmar. Member Kirschenbaum, Member Brown.
Thank you, Member Otmar. I agree with you, and Member Gustafson as well. I agree with you as well. We have to make this decision. We have to lead. Our students, our families are depending on us. Our teachers are trying to plan their first day, second day, Thursday, Friday, next week. We can't put this off. We need people to be able to do their very best. We need to do our very best tonight.
Thank you, Member Kirschenbaum. Member Brown?
Yeah, we all make tough decisions, and this is going to be one of them. And I don't see how delaying it one night is going to help anything. I think we need to discuss this now, which we are, and we need to vote on it.
Thank you very much. Anyone else? Okay, seeing none. So what you guys are voting on now is I want you to be very clear so that no one's voting on the wrong thing. You're voting on Member Mills' You're voting on Member Mills' motion, which would table or move this amendment until tomorrow. We're going to start with Member Ayala.
Ayala, no.
Member Bennett,
Bennett, no.
Member Brown,
Brown, no.
Member Dennis,
Dennis, yes.
Member Gustafson. Malaya? Maria? Sometimes she gets booted off. We'll come back
So
to
Megan, just to be clear, no means we're tabling it or we're not tabling it.
No means you are not tabling it, and we'll finish this discussion this evening.
Okay.
I'll come back to Malaya. Looks like she got kicked off. Member Haber.
Haber, no.
Member Kirschenbaum.
Kirschenbaum, no.
Member Lavoy.
Lavoy, yes.
Member Longbaliel.
Longbaliel, yes.
Member Mills.
Mills, yes.
Member Mitchell.
Mitchell, no.
Member Otmar.
Otmar, no.
Member Shapiro.
Shapiro, no.
Member Silva.
Silva, no.
Member Smith.
Smith, no.
Member Williamson.
Williamson, no.
Member Woodland.
Woodland, no.
Member Young.
Young, no.
Chair abstains and the motion fails. So we go back to the motion on the floor, which was the original amendment, which would bring students from grades 3 through 12 home, leave them home until at least January 19th, 2021, and would bring students K through 2 back on Thursday. Is there further discussion on that motion? Okay, seeing none, we're going to vote on the amendment. Is everybody clear what we're voting on? The amendment, Member Dennis's amendment. Okay. Member Ayala.
Ayala, no.
Member Bennett.
And no means we're not going with that. We don't agree with the amendment. Correct. Okay, so no.
Member Brown.
Brown, no.
Member Dennis.
Dennis, yes.
Member Gustafson.
Gustafson, no.
Member Haber.
Haber, yes.
Member Kirschenbaum.
Kirschenbaum, no.
Member Lavoy.
Lavoy, yes.
Member Longbaliel.
Longbaliel, yes.
Member Mills.
Mills, yes.
Member Mitchell.
Mitchell, no.
Member Otmar.
Otmar, no.
Member Shapiro.
Shapiro, no.
Member Silva.
Just to be clear, we're going, this is, yes means going with Member Dennis's update?
Correct.
Yes.
Okay. Member Smith.
Smith, no.
Member Williamson.
Williamson, no.
Member Woodland.
Woodland, no.
Member Young.
Young, no.
Chair abstains and the motion fails. So we're back to the original motion on the floor, which is to delay the start of hybrid until at least January 19th, 2021. We spoke about it quite a bit, but is there any further discussion on the floor? Okay. Hold on. Let's see, I think our first hand is Member Lavoy and then Member Mitchell.
I'd like to make a motion to delay this vote until tomorrow night to have ample time to hear from the public and to be able to.
Just the motion, please. So you would
The
like to
motion?
delay the motion?
The table tomorrow night. I'd like to speak to why.
Well, there's on a second, and then you can speak to why.
Mhm.
Is there a second?
I'll second it.
Okay, go ahead, Member Lavoy, you have the floor.
I would like to speak to why and think that administration has a lot of data in terms of working with principals, working with parents where kids cannot access the current remote model. I think it's pertinent for us as a school committee to understand what those numeric impacts are for our district. That way we can see, can we follow CDC guidelines to have those children back in school? I think having that data, as well as hearing from the public that are impacted by this, allows us to meet the needs of our community and fulfill our roles as school committee representatives, not as extensions of administration.
Thank you, Member Lavoy. This is very similar to the previous motion. Is there anything anybody would like to add to this? Seeing no one. Go ahead, Member Dennis.
Yeah, I mean, just to be clear, I don't think that Matt made this motion, and I certainly didn't second it, as shirking our responsibilities as a school committee to make a tough decision. We've made tough decisions all along. What I am in support of is the notion that this motion appeared on an amended agenda at roughly sometime between 12 p.m. and 1 p.m. This news is flowing fast and quick through our community, and I feel like we received a flurry of emails for people that felt like in the middle of their workday they needed to react, and I think that we should provide the opportunity for there to be some space for people to be able to have a public hearing. There may be not just parents, but there may be other constituents that wish to speak on this matter with us. And I think that we should afford the opportunity for them to do so.
Thank you, Member Woodland.
Thanks. So in the past, we have talked a lot about what we need to do to bring our district forward during this time. And one of the things that has come back up to us out of public comment, actually, and from emails that we've received from the summer and the fall, is listening to our administration for when they need help. And right now, our administration is saying, we need help. This unrolling is not going to go well for our community if we go forward. We need to hit a pause button. And I think that it is our responsibility as school committee members to our community to listen to our experts that we have put in these positions. We have our Board of Health listening, we have reporting, we have our administration, we have our superintendent, we have our director who's working on the contact tracing, which is not really supposed to be part of anybody's role in our school district. And yet here we are. I think that we have heard a lot of information. And what I would love to hear, instead of kicking this down to the next day, because as much as our intentions may be good, that's what's going to happen. I think we need to listen, and I think we need to serve our constituents well by listening to who we have entrusted to this position. And I think we should ask our superintendent to be working with the principals to bring the students who have been marked as struggling to access remote, to bring them to another point. But I don't really see how delaying this motion would get those students any help any faster. So that's my 2 cents. Thank you.
Member Woodland. Again, we're speaking to the amendment, which would push this vote of the original motion off till tomorrow. And again, if you have something to add that is unique, please do put your name in the chat. Member Haber.
I can support Member Lavoie's motion, not necessarily for the point of public comment. I hope that everyone listening feels free to email us, as 50 people plus have today. We're available to you to be heard. I feel like if we move public comment to tomorrow, all that will do is make a very long meeting. But I'm definitely open to hearing what you have to say. What I would like to move it for is to see if there are any other groups that we should try to be including. Maybe the K-2 wasn't the right people, but maybe there are special needs kids that do need to get in, and maybe we need to open up and expand what we currently have by some amount. And maybe that's something that Christine Smith can speak to. If she sees that there may be another group that does absolutely need to get into the buildings. So for that reason, I would support his motion.
Thank you very much, Member Haber. Member Gustafson, Brown, Otmar, Young, and Longo Leal.
Okay. Briefly, I don't think delaying until tomorrow will offer us any new opinions. I don't think, honestly, I know people have opinions, but in my observations of the emails I've been getting, the people who want to return to school and the people who don't are pretty much split and have been pretty consistently since we started this discussion. Keep all of my emails at least have similar arguments. They're all equally passionate and equally based in valid reasons. And I don't think delaying one more day is going to change that. The superintendent in his email, we did have a lapse in communication, but he sent an email about 24 hours ago that alluded to the fact that there might be some delay and there was Board of Health concerns and that families should be thinking about that. Again, we've been telling families since July at least, you must be flexible. The virus can change things in a moment. We can change from one to the other, from one day to another. There is no way to predict that. We've been telling families to prepare for that. I do think it would be useful if there was some path forward, whatever we decide, if the administration can then maybe revisit the conversation of who are these students that are in school right now. I think we would have time for those conversations if there were other high need students that, according to DESE, that is a very broad group that is not just kids in special needs programs. If we could have, the district could revisit that conversation after this decision is made, we can still bring more kids back in other ways. We have a chance to have those conversations, even if we decide to pass this motion, because DESE definition is not just kids in certain programs in special ed. It's a much broader definition. And I think the district could find some ways to creatively look at that. But we could still give our families an answer and our teachers an answer today.
Thank you. Thank you, Member Gustafson. Member Brown, Otmar, Young, Long, Balil.
This motion is very similar to Member Mills' motion, which we voted down. So I would like to call the motion.
Member Brown is going to call the motion on the floor, which is to delay the vote on the motion until tomorrow. Does he have a second?
Second.
He's made a motion. It's been seconded. Any discussion? Oh, it's not discussable?
It's not discussable.
Discussable. Member Ayala.
So we're voting for, sorry.
We're voting to start voting.
We're voting to start voting.
So if
Okay.
you vote yes, we will start voting on this amendment.
I vote yes.
Bennett?
Oh, wait. Okay. Now I'm confused. So,
Voting to start voting. So if you vote yes, that means you're ready to vote on the amendment, on the amendment to the motion, which is to push this till tomorrow. All you're saying is you're ready to vote or you're not ready to vote.
okay.
Can you clarify that, Megan? Clarify that.
Yeah. Okay. Because I feel like what we were.
We're
Okay, go
calling
ahead.
the question of the amendment. Calling the question of the amendment.
The vote is, we're saying, yes, we want to call the question, or no, we want to keep talking about this question. Okay.
Correct.
Right, just to be clear, when we call the question, we're saying this vote, if we agree to this vote, we're agreeing that we're cutting off discussion and we are taking up the vote as our very next item of business.
Yes. Thank you, Member Dennis. That's so nice of you to keep explaining. Member Bennett.
Yes.
Member Brown.
Brown, yes.
Member Dennis.
Dennis, yes.
Member Gustafson.
Yes.
Member Haber.
Haber, yes.
Member Kirschenbaum, please.
Kirschenbaum, yes.
Member Lavoy.
Before, yes.
Member Long-Balil. Linda.
I'm sorry again. No.
Okay. Member Mills.
Mills, yes.
Member Mitchell.
Mitchell, yes.
Member Otmar.
Otmar to vote to not let myself talk, yes.
Member Shapiro.
Shapiro, yes.
Member Silva.
Silva, yes.
Member Smith.
Smith, yes.
Member Williamson.
Williamson, yes.
Member Woodland.
Woodland, yes.
Member Young.
Young, yes.
So we're now going to vote on the amendment on the floor, which it would be to delay this motion until tomorrow. Member Ayala.
Ayala, no.
Member Bennett.
Bennett, no.
Member Brown.
Brown, no.
Member Dennis.
Dennis, yes.
Member Gustafson. Leah?
Sorry. Okay,
No
we're
worries.
voting on the motion to delay now?
Correct.
Okay, I will vote no.
Okay. Member Haber?
Haber, yes.
Member Christianbaum?
Christianbaum, no.
Member Lavoy?
Lavoy, yes.
Member Longbeliel?
Longbeliel, yes.
Member Mills?
Mills, yes.
Member Mitchell?
Mitchell, no.
Member Otmar?
Otmar, no.
Member Shapiro?
Shapiro, no.
Member Silva?
Silva, yes, I'd like to vote on this.
It's not to vote. You're voting on the amendment to push this till tomorrow.
Oh, then I don't want to push it to tomorrow, so that would be no.
All right. Smith?
Smith, no.
Member Williamson?
Williamson, no.
Member Woodland?
Woodland, no.
Member Young?
Young, no.
Chair abstains. Motion fails. Point of order.
It was just regarding time. Can I make a motion to extend the meeting?
Is there a second?
Second.
Second.
Is there any discussion? Ayala?
Ayala, yes.
Bennett?
Bennett, yes.
Brown?
Brown, yes.
Dennis?
Dennis, yes.
Gustafson?
Yes.
Haber?
Yes.
Christianbaum?
Yes.
Lavoy?
Yes.
Longbeliel?
Yes.
Mills?
Mills, yes.
Mitchell?
Mitchell, yes.
Otmar?
Otmar, yes.
Shapiro?
Shapiro, yes.
Silva?
Can you tell me again what we're voting on so I'm clear?
11 p.m.
Yes.
Smith?
Smith, yes.
Williamson?
Williamson, yes.
Woodland?
Woodland, yes.
Young?
Young, yes.
And the chair votes yes. We are now extended until 11 p.m. So the motion on the floor now is to delay the start of hybrid learning until at least January 19th, 2021. Member Mitchell has his hand.
I'd like to call the question.
Who would like to call the question? Is there a second?
Second.
It's been moved and seconded. So now you are voting to cut off discussion on the motion and then to move to a vote of the motion. Member Ayala?
Ayala, yes.
Member Bennett?
Yes.
Member Brown?
Brown, yes.
Member Dennis?
No.
Member Gustafson?
Gustafson, yes.
Member Haber?
Haber, yes.
Member Kirschenbaum?
Christianbaum, yes.
Member Lavoy?
Lavoy, no.
Member Longbeliel?
Longbeliel, yes.
Member Mills?
Mills, no.
Member Mitchell?
Mitchell, yes.
Member Otmar?
Otmar, yes.
Member Shapiro?
Shapiro, yes.
Member Silva?
Silva,
Wait,
yes.
wait. Sorry, Megan, but wait, I'm sorry. What, I got mixed up and I can't change my vote, can I?
No, I'm sorry.
Okay, so we're voting on the, okay.
Just to call the question.
Oh, just to call the question. Okay, yes, that's okay. Thank you.
Thank you. Member Silva?
Silva, yes.
Member Smith?
Smith, yes.
Member Williamson?
Williamson, yes.
Member Woodland?
Woodland, yes.
And Member Young? The question has now been called. And I abstain. The question has now been called. So the motion on the floor is the motion that is on our agenda, which would be, and I want to read it one more time for you guys. To recommend the delay of hybrid reopening for no sooner than January 19th, 2021. We're going to have a roll call vote on this. Member Ayala?
Ayala, yes.
Member Bennett?
Bennett, yes.
Member Brown?
Brown, yes.
Member Dennis?
Dennis, no.
Member Gustafson?
Gustafson, yes.
Member Haber,
Haber, yes.
Member Kirschenbaum,
Kirschenbaum, yes.
Member Lavoy.
Lavoy, no.
Thank you. Member Longbeliel,
Longbeliel, no.
Member Mills,
Mills, no.
Member Mitchell,
Mitchell, yes.
Member Otmar,
Otmar, yes.
Member Shapiro,
Shapiro, yes.
Member Silva.
Could you please clarify again? I just want to be very clear that I understood it correctly.
Yeah, as much of our voting to delay the start of school until at least January 19th, 2021.
Silva, yes.
Member Smith,
Smith, yes.
Member Williamson,
Williamson, yes.
Member Woodland,
Woodland, yes.
Member Young,
Young, yes.
and the chair abstains. The motion passes. Next on our agenda tonight is adjournment. Does anybody have a motion to adjourn?
So moved.
So moved.
Second.
Second.
Been moved and seconded. Any discussion? Member Ayala,
Ayala, yes.
Member Bennett,
Bennett, yes.
Member Brown,
Brown, yes.
Member Dennett,
Dennis, yes.
Member Gustafson.
I did have a question, but I'll just say yes because that's where we are. Thank you.
Member Haber,
Oh, good.
Yes.
Member Kirschenbaum,
Kirschenbaum, yes.
Member Lavoy,
No.
Member Longbeliel,
Longbeliel, yes.
Member Mills,
Mills, yes.
Member Mitchell,
Mitchell, yes.
Member Otmar,
Otmar, yes.
Member Shapiro,
Shapiro, yes.
Member Silva,
Silva, yes.
Member Smith,
Smith, yes.
Member Williamson,
Williamson, yes.
Member Woodland,
Woodland, yes.
Member Young.
Young, yes.
We will not be meeting tomorrow for clarification purposes. The meeting is now adjourned, and I will see some of you in subcommittee later this week and others in a couple of weeks. Take care.
This is Dr. Wace. Are you still there?